Members of a coalition on mental health have endorsed a statement that indicates effects of COVID-19 outbreak and the lockdown on provision of mental health services, including treatment and psychosocial support. One of the public health responses was turning mental health facilities into COVID wards. Accordingly, Ministry of Health has put an ICU infrastructure at the mental health facilities in the regional hospitals like Hoima and Moroto. During the lockdown, many people with mental disability in Uganda could not access the much-needed health care because of lack of transport as a result of restrictions on public transport, which affected their treatment. Among the increased cases of mental health after lifting the lockdown, Butabika registered over 1,680 new cases in July 2020.
Been channeled into very small corridors where our people are being treated. For us, that is a very big challenge. And most service providers, even the nurses who are supposed to handle people with mental health challenges, are the ones who are actually were the ones in the lockdown handling the people with COVID. Because they are the only ones who had the expertise in psychosocial support.
This highly impacted on the lives of such persons with mental health challenges, triggering them to break down, and also traumatization and re-traumatization of persons in the communities due to high enforcement and even
lack of access to mental health services in communities also led to some deaths in the districts of Moyo, Arua and Soroti. This impact of COVID-19 on mental health is expected to be long-term.
Two other deaths we got to know about in Arua, both women. One of the ladies, I think, was not on medication for quite some time, and she died by suicide. So she was found dead.
In West Nile,
yeah.
In Moyo, we registered 2 deaths of persons with epilepsy, just because they could not access medication. So that is just a drop in the ocean.
The activists are now calling upon government to return to them their health facilities and services.
Call upon the Ministry of Health for urgently doing the following: provide an urgent plan on the reopening on mental health clinics at district and regional referral facilities for persons with psychosocial and intellectual disabilities.
In the health budget, mental health is allocated 0.7% funds, which is less than 1%. Mental health-related activities require government investment in psychosocial support services because many patients can be on medication for a long time but fail to get better. Meanwhile, members of the Coalition of Mental Health want government to start operationalizing community mental health services as stipulated in Section 3 of the Mental Health Act 2019. I'm Nafka